say, Dan Bright, Westminster is a great church. It's a conservative church. It's good. You know, many people have had to leave some of the United Methodist churches lately. And that's one of those churches that they went to. And we went to the Global Methodist Church. And my son's a pastor, which is so bad. But Andy is an amazing minister. That's a great church. And Dan is right. I'm so sorry. So let's keep it in your career.
Mm-hmm.
Okay. How to transition from that?
Yeah.
Anybody want to go first? Rusty will go first. Okay. So these questions, again, came from our Washington County voters. They're more designed for state level types of questions. And so I'm going to start out with the first question that Washington County voters are concerned about: taxes, growth, infrastructure, health care, election integrity, public trust in the direction of the Republican Party. What is the most important responsibility of the office that you seek and currently hold? And how would you strengthen trust with Republican voters?
Well, thank you. First, let me thank Danielle for putting this together. And thank you for coming from California to Tennessee. This is the real America. Thank you. We're a constitutional republic. A constitutional republic. We're a representative form of government. That said, it's a pretty easy question. It's like Anita said. We've got to make sure as legislators that we know what you want and take that to action. It's a representative form of government. That's what we do. Now, as far as trust, perspective on trust, I've trusted you for years, and you've trusted me for years because you've put me back in office many times. You have asked me to fight for me and to make sure that I focus on certain things: lower taxes, less government intervention into our lives, personal responsibility, faith, family, freedom, common sense, personal rights, property rights. Those things we can fought for naturally. To gain your trust, you have to go down there and do what you say, do what you ask us to do. My job is to educate you, to make sure I talk to everyone, and to make sure that I take your message to Nashville, which is what I've done. And I hope that you feel that trust has been there. And it's been the honor of my life to represent you, with the exception of my kids and my family. It's an honor of my life to represent you. I love what I do. I'm good at it. And I'm appreciative of sending you back because we do have that trust together.
Thank you, Rusty. Dan, you want to repeat that question?
Yes, please.
So the question is, Washington County voters are concerned about taxes, growth, infrastructure, health care, election integrity, public trust in the direction of the Republican Party. What is the most important responsibility of the office you seek, and how would you strengthen trust with Republican voters?
Well, I agree with most of what Rusty said, but I did want to expand a little bit on some of those discussions. I certainly believe in the Constitution of the United States and the Constitution of the State of Tennessee. I think it's very important that we choose legislators that understand the Constitution very completely. I think, and especially since I've been on the campaign trail, the biggest question that we've had, and the biggest question I've had, the comments that I've had about health care. Our state constitution actually does not permit for the formation of monopolies. But that's what we have here in East Tennessee. Something else that I think is really important, especially on the 250th anniversary of the signing of our Declaration of Independence, is that our founding fathers never anticipated that politics would be a career. And even though I do think Rusty's done some good things in his political career, 36 years is a long time. 20 years without a primary opponent is a long time. I want you to think about where you were in your life in 1990. In 1990, I was graduating from Eastern Kentucky University. I wasn't married yet. I hadn't started my professional career. Since that time, I moved to Johnson City 31 years ago. I went back to graduate school. I raised 2 children. I now have 2 grandchildren. I've changed jobs multiple times, and now I own my own business helping independent physicians stay independent independent. I believe it's time for a change. And I think the people in District 3, Washington, Carter, and Johnson County are also ready for a change. And I think we need someone who's willing to fight for those things that we all think are so very, very important. Thank you.
Well, since we brought up probably the most important issue, let's talk about healthcare. Anytime there is an issue, this is a little off, anytime there's an issue, some people will use bumper sticker philosophy, and some people will use talking points. For example, smart growth. Is there anybody in this room who's not for smart growth? Well, for environmentalists, that means no growth, and for some developers, it means planned growth, and for some people, it means rape and pillage the land. So that's what's beautiful about these kinds of dialogues, is that we get to talk about the substance of the issues. So let's talk about healthcare. The certificate of need issue is something that is part of the state policy, and it's created controversy in relation to healthcare endowment. And so the question is for you, is what is your position on Tennessee's certificate of need laws, and do you believe those laws limit healthcare competition in Northeast Tennessee, or does it expand it?
Certificate need laws have always impeded growth in healthcare. They've always limited access in rural areas of our country, not just Tennessee. I've been fighting with organizations that I work with for the last 10 years to try to get certificate of need to be repealed. I actually have been part of the process that Senator Crow put in place 7 years ago, and it resulted in a 5-year study as to what the effect of certificate of need was in the state of Tennessee. All parties were able to discuss with a group of legislators as to what was important and how did we move forward to improve rural access. At the end of 5 years, which was 2 years ago, we came up with a plan, and the Health Facilities Commission came up with a plan to undo all of certificate of need by 2027. We all thought that was great. We were all in agreement. And in the 11th hour, special interest came in, and the Tennessee General Assembly once again kicked the can down the road. Who also agrees that certificate of need is bad for the state of Tennessee? The Trump administration, the DOJ, the FTC, and the Center for Medicare and Medicaid. And how do I know that? How do I know that? Because the rural healthcare transformation that Tennessee applied for in November is dependent upon our state not having a certificate of need. Governor Lee wanted that to be completely abolished by 2027, and what did the General Assembly do again? They kicked the can down the road. Tennessee is going to lose some of their rural healthcare initiative money, transformation money, because they did not follow that application. We need to do something about that.
Yeah, no, Dan's right. I started the process to do away with certificate of need because I heard from our people here at home how important that was to again have competition in our area. Heard that loud and clear. It took us years to get to the point that we could get the votes to do anything at all. So we had two votes prior to this last vote. I voted for both of them to start phasing it out, to start doing away with parts of the certificate of need so we have competition in our area on different things. This year, the vote came up to do away with certificate of need. To do away with certificate of need. I voted for that. Senator Watson brought the bill. And what happened was, the vote was to do this in 2020. So we would have had to wait till, 2030. We would have had to wait till 2030 for competition in our area. Timothy Hill and I forwarded amendments to that bill because we knew, we had heard from you that you wanted the COPA and the CON to be together, and you wanted to do this sooner than later. We amended the bill. I did that to make sure that in 2028, we will have competition here, not 2030. I also put an amendment in with Senator Hill to save Caring Hearts cardiology. Caring Hearts was going to go back under the umbrella of the certificate of need process. I saved Dr. Stundike's business by putting that amendment in to keep Caring Hearts doing business, because I had heard from the patients out there how important it was to them. I was actually approached to not do that, but that's not the way I operate. I know what the people in my district want. They wanted Caring Hearts to be out there operating. I put the amendments in with Timothy Hill to do that. And so I'm proud of where we are. We now are going to have competition quicker and sooner than any of the other parts of our state. And we did pass that certificate of need to do away with that.
Thank you, Mr. So this follow-up question is on the same issue. It's regarding ballot health care accountability. We are a region with limited health care competition. What should the state senate do or can do to improve accountability for access, wait times, pricing, service quality, and patient choice? Actually,
Well, we just did that. We did away with the COPA, Certificate of Public Advantage. We put it in the hands of the Attorney General, who has the full force of antitrust laws. He controls that in Tennessee. He controls the monopolistic activity if it were to occur. So we did that. We took it out of the hands of the Department of Health. The Department of Health is very political. It's appointed by the administrative branch of government, by the governor. The Attorney General, on the other hand, is appointed by the Supreme Court. There's no politics involved there. If someone wants to call and say, oh, we love ballot health, the commissioner loves ballot health, do what ballot health wants, we took that out. Now, anything that is complained about, whether it's quality, dirty hospital rooms, bad service, poor wait times in emergency centers, that all goes to the Health Facilities Commission, where it was going anyway. That goes there, it's investigated by their team, it becomes public, just like it would if the Department of Health were still in it. And we also have maintained the restrictions on raising prices through the ballot system. That monitor is still there. That's going to remain. And I don't know why Dan thinks we don't have that force of oversight. That we have much more force of oversight than we had before. We did that, and that's where we are.
Go ahead, Dan.
I think I'm ready. So, I think the first thing that we need to get clear is COPA's not going away. They only took away the guardrails for the Department of Health to look at access, to look at quality. This has been an evolving process. And Terms of Certification 5, which is part of the Certificate of Public Advantage, actually put a little bit of teeth into it as far as their quality scores. So I'll just say one thing before I go on. For those that are given much as expected, if you're going to get a state action immunity from antitrust, you should be able to show that this is truly something special. And they haven't done that. The only thing that the General Assembly did was take out those guardrails. So now when it comes to access, when it comes to quality metrics, when it comes to operational expenses, those are the parts of the COPA that were taken out. Nothing has changed with the Attorney General's oversight of the COPA. Nothing has changed. And for the last 10 years, I've been hearing that the reason we don't do away with CON faster is because the Health Facilities Commission is not prepared to do so, and they're not ready. The Health Facilities Commission has a charter from the Center for Medicare and Medicaid that they do licensing for healthcare facilities. But if they're not prepared to do away with CON, how can we expect them to make sure that they're doing their job of monitoring a medical monopoly? I contractor, I'll say it. But when you look at his ethics report and where his income comes from, since the formation of Ballot, the majority of his money is coming from Ballot. And I'm just not sure when you wake up on July 1st of 2028 that we're going to have real competition, but we're still going to have a real monopoly. Thank you.
I do allow follow-up questions, but Russ, I'm going to ask you to stay specific to the point that was just made with it. One of the challenges that I am aware of with rural healthcare, because I came from a place that was rural healthcare, is that it's very difficult to get somebody to invest in an area that's got rural healthcare. So what would be your response to that? And just stick with that particular issue.
Well, I think now we have that openness now that anyone can come in, and that's a good thing. But what I want to address, Mark, is that Dan is trying to say that it's a bad thing that I contract with Ballot Health. Listen, he contracts with his physicians groups just like I contract with Ballot Health. I'm not an employee of Ballot Health. When I killed the income tax years ago, so we don't, any of us have to have a state income tax, I lost my job because the Republican governor that I stood against said, I don't like that. I'm firing you from the university where I worked for 20 years. I had to find another life. I went into wound care and hyperbaric medicine. I help people with lower extremity diabetic wounds, people that have osteomyelitis, necrotizing fasciitis, all those things. I help them heal their wounds. I develop programs. I make sure physicians understand that. And it's, how dare you try to say that it's wrong for me to do the work I do? We are a citizen legislature. We have lawyers, doctors, healthcare workers like me. We have insurance executives. We are a citizen legislature and we all have jobs. And it's disingenuous for him to say that it's wrong for me to do this when he does what he does for his doctors, because when we do away with CON, as we have, his physicians can make millions of dollars doing those services that now hospitals used to do. So I don't want to bring those kinds of things up, and it's wrong for him to say it's wrong for me to work in the profession that I do. And you're right about rural health. Thank goodness, I fought for 5 years, like he said, to do away with CON. Finally, President Trump said, we're going to do this because we have to transform rural health. That's when I got the force to help me get this done, and we got it.
Yeah, it was his rebuttal.
I have a response to follow-up. He went first.
That's right. Yes.
I can't
Yes.
get a second on that follow-up question about rural health care.
Yeah.
I mean, I think the press is going to throw it out. We need to make sure that everybody understands. I own a business called Citizen Consulting. 7 years ago, I actually had 18 contracts with independent physician groups across the country. And working with them, it was usually piecemeal type of work. So as long as I worked at least 10 hours a year for them, they continued their contract. 7 years ago, my wife and I decided when my mother was diagnosed with cancer that we were going to scale back our business. And so now I have 3 contracts, and I've listed all 3 of those on my statement of interest. 2 of those physicians' office are one-physician groups. The other one is an independent physician association that I help with a whole variety of things, contracting, CMS regulatory issues. I am a subject matter expert in those areas. Rural healthcare will get better when the CON goes away. But I also want to tell you something about Caring Hearts. I'm the one that found that in the legislation that we closed in. That's why my signs are all over Caring Hearts. And it was Timothy Hicks, I'll give credit where credit's due, that I contacted and made sure that he got that amendment in place to save Jeff Stringdike. But I want to tell you what's the difference between a hospital-based clinic or a hospital-based facility and a private practice like Jeff Stringdike. subcommittee, or full committee, when they were hearing discussion about CON, Rob Gregory, CEO of Caring Hearts, reported to them that since they've opened, they've saved Medicare $1.4 million. That's in 1 year. They saved private consumers $500,000. Because when you have the exact same procedure in the exact same type of facility, it costs less at an independent physician practice. Physicians, if they were making millions, we wouldn't have a problem recruiting independent doctors to our area. We're having problems recruiting independent doctors to our area because we have a monopoly healthcare system.
I know that's probably the most difficult topic that we're going to be talking about today. And coming from a rural area in California for 40 years, we had rural health care, and our healthcare hospital changed hands 8 or 9 times in the 40 years that I was there. So I know how difficult this particular issue is. So let's move on to something a little different. This is about growth and taxpayer protection. There's a lot of growth taking place in Tennessee. There's a lot of people moving in. How should the state help local governments make sure that growth, data centers, and major projects do not shift infrastructure costs to existing taxpayers or ratepayers with subsidies and other tax benefits to those people coming in? That's for you, Dan.
Thank you for the question. And I do think that a lot of that is up to our local county commission, but I do think the state definitely has an interest in that. And when it comes to things like data centers and Bitcoin operations, even though that is a local issue, I think the state needs to make sure that our infrastructure, utilities, electric grids, those types of things are able to handle those. And I would really suggest that instead of us going down the path of like Virginia, where they had this incredible growth and now they're having brownouts and blackouts, I actually think the state of Tennessee should do something to try to curb that, or maybe make a moratorium on data centers, AI data centers, and Bitcoin. Now, I do think that there is a distinction. There are data centers already in our area. And there's one that's actually been here for over 20 years. It started out as a data center for Eastern Chemical so that they could centrally store all data from all of their organizations across the world. Now, I still think they use it, but that data center is now owned by Ballad Health. It is over in the MedTech Park. And everyone here probably drives down State of Franklin. You probably have driven past State of Franklin 1,000 times. And you probably didn't even know that data center was there. Another one is in Duffield, Virginia, which is also a medical data center, one partner. And it's been there for about 20 years also. So there are things that the state can do to curb those types of things. And now when it comes also into that area, I think the General Assembly has impact on what's happening with our state environmental protections. Air quality, water quality, things that sometimes are byproducts and negative byproducts of these types of programs. We also need to make sure that we're with our substantial growth, protecting our family farmers in the green areas of our area.
So I think the last part of the question was essentially how do we keep our taxpayers and our communities from having to foot the bill for these data centers? Well, the answer is exactly what I just did this year. I sponsored a bill with Senator Taylor to make sure that we have prohibited, the governor signed it a few weeks ago. As of that signage, no data center can come in to Tennessee and have your municipality, your city, or have your utility companies foot the bill. They cannot do that anymore. We prohibited that. It's not going to happen. Now, I got a bill the other day, and I read Danielle's editorial. She does a great job of it. It made me go back and check. Turns out, years ago, when Senator Norris was a judge, President Trump made him a federal judge, he passed a bill for FedEx. And the wording in it was AI to give tax credits to help FedEx. This was essentially for FedEx's, I guess you could call it a computer organization to come in and operate. It wasn't an AI center just like we know today. Those data centers that are coming in, they use too much of our water, too much electricity. They don't bring jobs. They're not community oriented. That's when I stopped with my legislation just the other day. But we are going to have a balance because we're going to need AI to diagnose some of our illnesses. We're going to need AI for medical research, all those kind of things. So we're going to have to figure it out. I'm going to bring a bill to do away with the legislation Senator North brought because it says data centers and it doesn't really mean those data centers, but it could be used for that. So we're going to do away with that. But I was able to stop it. The governor signed that the other day, and I think we're going to be in good shape. But we do need to move forward, and I agree with Dan to go even farther next session.
So the next question is similar but a little bit different, and I heard there's a phrase subsidiarity, which means that we want to take care of things as close to home as we can. We want to take care of things, our family first, our city next, our county, our state. We want to take care of things close to home. But we do have some issues that are rather large, and BWXT and that accountability is a big issue. So the question that I would have for you is, what role should state government play in safety, environmental, emergency response, and public communication standards when there are sensitive industrial projects or federal contractors such as BWXT in our county? And that's where you need to start.
We should play a huge role. Here's how it works. You ask what role the state government should play. And the state government's role should be that we ensure the safety of the workers in these plants, the public that live around these industries, and the environment. We have passed very robust, strict laws, regulations, and rules that these companies have to follow. When we pass these laws, we don't just do what the federal government wants, we go above it in Tennessee. You will find if you go on TN.gov and look at some of these rules and regs, we are stricter than the federal government. So, to make this work, to enforce those rules, and to ensure compliance, we have TOSHA, TDEC, TEMA, and the radiological health group within the Department of Environmental Conservation. TOSHA is the Tennessee Occupational Safety and Health. They're the ones that have to make sure worker safety is there. TDEC takes care of the community and the environment. And then TEMA, Tennessee Emergency Management, takes care of any of those emergency situations where you have spills and things like that. And then the radiological health group, they work with the National Regulatory Commission, the Federal Commission, to the letter. So that's how all this compliance takes place, and it is in place right now. Now, communications was a part of that question. The BWXT group is under what's called the Community Rights Act. That's a federal act. They have to be very vocal and open about what they're doing. Now, obviously, a lot of that's top secret. I had a top secret clearance when I did what I did in Vietnam. But I can tell you this, that company is now been authorized to make munitions to try to make up for the stock that we've used in the war with Russia. And so that's where we are. That compliance is there from those departments of the state.
Well, in preparation for that question, because we did have access to these questions before, I did do some research and look up. I'm not going to say that I know everything about everything, but I do know what I don't know. And I think in addition to the things that Rusty said, which would be how I would answer the question too, of making sure that regulations are being followed and making sure that there's real consequences if they're not. I also think that we need to really make sure that we're listening to the people that live
now approaching the end of our time for this, so you'll all get the easy question to end, and I'll start with you again. What is the most important commitment that you are willing to make to the Republican voters in Washington County if you are elected to this position?
I think that's really easy. I've already started attending county party meetings. I've already started reaching out to county commissioners. I've already started reaching out to county boards of education because I want to make sure that I'm a present person, that I'm actually there, and that I'm willing to listen, and not just kind of show up around election time, but to make sure that I'm there on a monthly basis to answer any of those types of questions. And then I also think that, going back to that idea that I don't know what I don't know, I've already started meeting with local farmers in Johnson, Washington, and Carter counties. Because there's going to be times where I'm going to have to be making decisions about legislation or about policy that I think are really important to those areas. And I want to give just one other example. You know, I believe iron sharpens iron, and I believe that we all have to be accountable for the things that we've done. And I want everyone in this room to hold me accountable when I'm the next state senator. But in 2012, in Carter County, a decision was made by then Mountain States Health Alliance that they were going to close their OBGYN ward. And I think this is really important because as the city chairman of Senate Health, Rusty wrote a letter of support for that closure. I have a copy of it today if anybody would like to see it. And it's on his letterhead. But for the people in Carter County that were working in those areas, the OBGYNs, the pro-life groups that were working in that area, they had no idea that CON was getting ready to take place. And had they known, they would have written letters of opposition of the closure. As your state senator, I will come to you before those types of things happen so that you can have input. Within 2 weeks of the closure of an OBGYN, a young mother delivered her baby in her car. I think we need to do better than that.
I can tell you that the decisions that are made like that are made back then with the Department of Health and we don't have that anymore as of the COVID. Three things I guess that would be important that should provide. Number one, I promise you I will keep one foot firmly planted in the Constitution and the good book. The other foot, number two, planted right here at home with you so that I know what to carry in Nashville and what you care about and what you want. And number three, that I will always do what's right. And doing what's right, I can tell you from experience, is dangerous personally and dangerous politically. When I killed the income tax, I lost my job, had to change my life. Thought I probably wouldn't get reelected, but I got reelected overwhelmingly because I stood up for the people. This year, I stopped the PDM practice that was being undertaken to hurt pharmacies and to hurt you. President Trump has been working with the countries overseas to form agreements with them so that when they bring these drugs into the U.S. and bring